Hello, I'm Carla Maldonado, and I will be going over the program proposal and plan for simplified infusion services for chronic care in rural communities. The program's purpose is to make home infusions more convenient for patients with chronic immunodeficiency disorders by providing them with live video telemedicine visits in rural locations. The program pilot will launch in the state of Arizona. There will be 4 spoke site hospitals, including Flagstaff Medical Center, Yavapai Regional Center West in Prescott, Florence Hospital, and Tucson Medical Center. The main hospital where the immunologist will be located is Honor Health John C. Lincoln Medical Center in Phoenix, Arizona. Initially, the patient will meet with a doctor and nurse in one of the rural hospitals for evaluation. Blood work and all required lab testing will be completed, and the information will be transmitted through EHRs to the specialist. And a telemedicine visit via video call will then be scheduled. It will include the specialist in the hub and the patient, doctor, and nurse in the rural hospital. The patient will be evaluated by the specialist with the help of the doctor and nurse, and an infusion treatment plan will be established. All tools, including a tablet for communication, will be provided to the patient. At this moment, the nurse will take over the patient's care. The nurse will educate the patient about sterilization techniques, how to install and remove the catheter, how to use the pump for treatment dispense, and how to use the tablet for communication. The nurse will schedule telemedicine visits with the patient as needed and will forward all information to the specialist. If the treatment needs to be changed, the clinicians and patient will have another video call to reevaluate treatment. The goal is to launch the pilot program within 6 months, evaluate metrics for 1 year, and continue with the go live if the pilot succeeds. The objectives include 20 to 25% reduction in patient hospitalizations, readmissions, and emergency room visits. The pilot program success will be evaluated based on the reporting of several metrics, including 75% overall patient satisfaction through questionnaires. In addition, the cost of healthcare support teams, clinicians, team management, along with technology tools and education will be evaluated in comparison to reimbursement. The reporting will be conducted monthly in the pilot's 1-year period in order to monitor clinical activity and program success. The timeline for the program's launch date is January 1st, 2020 through June 30th, 2020. All required tools, services, and technology to run the program will be purchased between January 1st and February 1st. Training for all departments will begin February 1st and run up through May 31st. The last month, June 1st through 30th, will be dedicated to process improvements based on training feedback. The last week, June 23rd through 30th, is when patient referrals will be accepted. The official launch date of the pilot program is July 1st, 2020. The legal and billing aspects of the program will be handled throughout the last 5 months of the planning period. The program requires $2.7 million in funding. Technology includes $23,700 based on purchases of tablets, USB dongles for internet access, and Zoom for healthcare. The training budget is $250,000, and the salary budget for clinicians, managers, and other support teams is $1.4 million for the first year. A miscellaneous budget of $1 million is included for other necessary expenses. The financial strategic value of the program is reducing costs by 10%, avoiding costs by 25%, and generating revenue after the pilot stage. The funding of the program will be through a grant through the Rural Economic Development Loan and Grant Program, since it provides funding for facilities and equipment that provide medical care to rural populations. The program's technology includes tablets that will be equipped with Zoom for healthcare. The communication service provides HD video and audio. It is available in low bandwidth areas, which is necessary for rural locations. It has built-in instant messaging. It is HIPAA compliant, and it integrates with Epic. Only transmits encrypted information, and multiple members can join the video conference. This is important when the nurse and patient need to consult with a specialist. The other communication tool that was considered for the program was Video for telehealth. However, it did not have all the qualities that Zoom for Healthcare has, including the annual price of $2,400. Legal complications can arise when the program expands, including physician licensing. A solution for this is recruiting physicians that are licensed in multiple states or by expanding the hub locations. Patient data privacy will follow HIPAA guidelines. Arizona's telemedicine policy requires both Medicaid and private payers to reimburse telemedicine-related healthcare. However, this is not the case in all states. Therefore, policies across the country will need evaluation to determine if expansions would be possible. The program-specific policies include store and forward services, only through live video. Online prescriptions will not be allowed without a physical examination. The patient's oral and written consent will be obtained prior to the start of care. All video conference calls, notes, and treatment details, along with medication updates, will be included in the patient's EHR. A disclaimer will be provided to the patients informing them that the telemedicine's changes are depending on current laws and regulations.